Hi everybody, Dr. Daniel. Today I'm talking about at what age do migraines stop? Well, migraine is a genetic and familial condition that usually starts late teens, early 20s. And the question everybody who has it wants to know is, when's it going to stop? And it's hard to answer. We can give some general comments about that. So for women, migraine generally stops between the ages of 65 to 70, and for men between the ages of 50 to 60. Now, there's about a 2 to 5% of persons who will continue having migraine after age 80. And even though migraine generally starts in teens, like I've said, some persons don't start it at all till late in life, or some women start it during perimenopause, which is like in their 40s or so. I have some other comments about migraine for women. I think it's important here to divide women with migraine, into different groups, like the International Classification of Headache Disorder. Version 3 has migraine without aura, migraine with aura. They have menstrual-related migraine with or without aura, and then there's pure menstrual migraine. The importance here is because something like 60% of women who have migraine may have estrogen-related issues. And that number varies, but I'm going to use that today. And about 40% of persons, women with migraine, don't have estrogen or menstrual relationships with their migraine headache. And those people have longer migraines because the estrogen-related headache patients with migraine generally stop after menopause, which has an average of 51 for women. Now, pure menstrual migraine are ladies who only have migraine headaches when they're menstruating. So that's 5 to 7 days a month they'll have a migraine, but they don't have headaches at other times. Whereas the term menstrually related migraine, those folks will have some headaches during their menstrual cycle, but they may have migraines at other times during the month as well. So what's the effect of menopause on migraine? And I have several studies here listed. I'm just going to read some of this. One of the studies showed that menopause made migraine worse for up to 45% of women, but 30 to 45% didn't notice a difference, and 15% of women during menopause noted that improvement. All right, what age does migraine stop for men? So something like 40% of men will lose their migraine by age 65. Sometimes they'll lose their attacks in age 50 to 60 years old. And so migraine and stopping holds true to the general idea about migraine, which is common in women, probably related to estrogen issues. Well, what about this? Does migraine get worse in adults? Well, yes. As you age, migraine gets worse generally. So they become more frequent and more intense as we age. Headache studies have shown that the numbers of migraine headache days increase as time goes by and we get older. There may be also a transformation with medication-induced headache from episodic migraine, which is less than 14 headache days a month, to chronic migraine, which is 15 headache days a month, 8 of which have migraine features. And the reason migraines get worse with aging are not all clear, but that can relate to the usual triggers or aggravating features of migraine, like stress, head injury, life changes, and things like that. Okay, are there changes in the brain of patients with migraine as we get older? Yes. And it's worse in migraine with aura than migraine without aura. And the numbers I have for that are that migraine with aura has 8.1% history of changes in the brain, and migraine without aura 2.2%. And the changes we're talking about have different names. I like to call them T2 microvascular disease. Some people call them white matter lesions. They can also be called spots or white dots, or WMAs, which are white matters, abnormalities, all these little things. They look like little dots that appear in the brain, mainly seen in cross-section on MRI scan. It takes an MRI scan to see this. You can't see this on a CT. The other thing that's sort of weird is that you will find on scanning persons with migraine that you'll see small strokes of brain infarctions more commonly with migraine than with other persons. And it's worse in women. 8% of whom have a subclinical cerebellar infarct, which will occur. And these usually are clinically silent and don't show anything. And then the other thing I'm talking about is these T2 lesions that are seen on the brain of people with migraine. As far as we know at this time, they don't cause any problem. It's going to be studied. I generally feel like persons who have that probably should be really doing the migraine lifestyle and probably get on a good preventive to stop their migraine and also probably stop the lesions occurrence because they tend to accumulate with aging. But there's another condition I want to talk about here, which is what about the occurrence of what's called acephalic migraine? It really means migraine are symptoms without the headache part. The terms that this is called are migraine are without headache, amigrenous migraine, isolated visual migraine, and optical migraine. You'll hear all those terms. It rarely occurs in men. Usually you'll see it in middle-aged women, though. And these folks have a typical migraine, usually a visual aura, but it also could be numbness and tingling, rarely. And they'll see spots or holes or zigzag lines, just like the usual migraine patient does. They may have flashing lights or things like that, which last minutes and go away, but they don't have any headache with it. That's why it's called acephalic migraine. So many of these women are age 65 or so, and oftentimes they don't have any previous history of having migraine at all. Although many of them, in my experience, have had what are called migraine links or migraine aliases, and these are things like menstrual headache, which usually relates to migraine, hungry headaches, which are usually migraine, nocturnal middle of the night headaches, which are usually migraine, sinus headache, which really doesn't exist, which is all of those are migraine. But the person may have had motion sickness, which is another link to migraine. And these persons with acephalic migraine stop their attacks about the same time as regular migraine does in the patients I've discussed earlier. Okay, what is a common provoking habit of elderly persons with migraine? So if you see somebody past the usual age of migraine, most of these are women because migraine occurs in women 3 times more than men. You're usually seeing older ladies, 70, 75 years old, and their chief complaint coming in is they have daily headaches and they've been over-treating with some kind of painkiller, and they get medication of anesthetic, often with chronic migraine. And so that's a real problem. And you just try to detox them and reinstruct them, get them off of the drugs they're taking, and to limit all headache drugs to no more than 2 days a week, and they'll basically be okay. But what about persons with abdominal migraine? Well, these are kids who are really young. So I've got in my notes here that starts in patients about 11 to 20 years old. So it's younger age than the usual onset of migraine, which is late teens to early 20s. And these people, a large percentage of them just grow up and go into regular migraine. And so they may have migraine experience longer than the typical migraine patient, but I don't have any data that shows that the age at which they stop is different from what I've discussed earlier with migraine. I also would push to all persons with migraine close attention to the next things I'm going to discuss, which are doing the migraine lifestyle, to get on treatment with triptans. They're the best drugs still for acute therapy of migraine, and probably take one of the new CGRP drugs for treating migraine, because occasionally just lifestyle changes, use of triptan, and preventive therapy will stop migraine right there. And it's odd, but it does occur. Okay, so what is the migraine lifestyle? We're talking about here not using caffeine, exercise, avoiding fasting, setting your life to have adequate sleep. So persons, adults, should have maybe 7-8 hours sleep every night, and people who cut that pay for it. The Mayo Clinic has said years ago that people who only sleep about 4 or 5 hours a night don't live very long. I'm also reading articles that say that persons who don't sleep well at night have an increased incidence of dementia. Nobody wants that. So try to get adequate sleep. Well, the other thing, and bring this on, in terms of lifestyle is dealing with stress. So many people I talk to don't relate to have any stress. They feel like I'm talking to a wall or something. Talking to them is like it's somebody else's problem, but it's not mine. They either don't understand what stress is, or they don't want to talk to a non-regular doctor who's not a psychiatrist or something like that. Even though in medical school they teach you 70-80% of problems you're going to deal with as a doctor are going to be psychological. So the stressful events in life can aggravate migraine. Now, these are change of environment, like leaving home, go to school, or starting a new job, the death, accident, or major illness of a parent, grandparent, sibling, close friend, spouse, or sweetheart, birth of a new child, loss of a job, starting a new job, financial stress, mortgages due, old bills, unexpected financial responsibilities. These things are just the normal flow of our life, and we need to have a support system in our lives, people we can talk to and help counsel with us. It's usually our spouse. If you're not married, it could be friends or close relatives. Maybe a religious person like a preacher, priest, or rabbi. And dealing with those things can be helpful to deal with migraine. And we all avoid over-treatment of migraine headaches because that can aggravate headache. In general, the rule is to stay less than 2 days a week at any kind of drug you're taking. Aspirin, if you're going to use that, Excedrin, caffeine, triptans, any of the new CGRP drugs that are used in that regard for acute therapy. There's just no data at all on the use of opiate narcotics and butalbital for treating migraine. In fact, America's in this huge cataclysmic upthrow of problems of doctors using narcotics, and persons become addicted to it. In fact, butalbital, which is found in Fiorinol or Esjec, has been banned in every country in the world except Canada, the United States, because it causes medication overuse headache. And so no one should ever be taking those drugs. Okay, next I'm going to talk about acute therapy, and generally that's going to be with triptans, and there's 7 of them. The first one came out in 1991, was injectable 6 milligrams subcutaneous sumatriptan, and that's still the best drug, but most people don't want to take a shot for it, so you can get it as a pill. There are others that can be used. But these are the only drugs that have headache-free days that are reported from the use of the drug. So if you treat a migraine headache at prodrome, at the onset of an R, at the onset of a headache, 70-80% of persons can be headache-free in 2 hours. And nobody else can imitate that data. Starting in 2020, we have new drugs, which are Nurtec, Ubrevely, and Rayvow. These are drugs that work for migraine. They're more expensive. They're name brand. They may fill in and help a little bit for that 20 to 30% of patients who have migraine treated with triptans that don't do well, or persons who have a contraindication for taking triptans, like out of control high blood pressure, or previous stroke, or heart attack, or something like that. You could use those drugs there. But they don't act as quickly and as well as triptans. And then you could consider getting on old-time preventive drugs. Sometimes they'll work and stop migraines. So I'm talking about Depakote, topiramate, beta blockers like Inderal and amitriptyline. But the new news on migraine therapy the last several years is the use of the new CGRP drugs, and there are 4 of those. And they all are said to work about the same. And what's reported on those is that 25% of persons who take one of these, usually an injection subcutaneously once a month, half of patients who take that persons who take that can have a 50% reduction in migraine headaches, and another 75% of patients who use it can have, I'm not saying that's right, another group of patients can have 75% reduction, and a final group, real special group, can have 100% reduction of their migraine headaches. I've had patients who've had migraine chronically for years that just had it stopped from taking these drugs. So you want to get rid of migraine and want to know what age it stops, consider getting on one of the new CGRP injectables. Okay, so these are pretty much my thoughts on the age migraine stops. Hope it's been helpful to you. Please click on like down there. Look at my blog at www.drmigraine.com. I have a lot of issues. I have this article there with pictures even. I'll see you again on the next talk.